Welcome back to Morning Break and our first ever segment of Brain Matters, sponsored by Gates Brain Health. We, of course, have Dr. Randall Gates, our board-certified chiropractic neurologist and chiropractic physician, joining us. You have been a regular on the show for 2 years now, which is
2 years? Wow.
2 years, which is very, very hard to believe. But we are so excited that in the new year, we're giving you your own segment so that we can really dive into what you do best, and that is matters of the brain and of the gut. And so this is really exciting. This is Brain Matters. You'll be on every 3 weeks, and I'm excited to kind of start today's segment by reminding people who may be just joining us now for the first time in the new year what exactly you do as a chiropractic physician and chiropractic neurologist. Those are doctor terms that we don't hear about very often.
Exactly. So I like to explain it as personal training for the brain.
Okay.
If you were to go to the gym, you wanted to get in shape, you would consult a personal trainer. They would guide you on how to get your muscles stronger. In our healthcare arena, we have different treatments for the brain. Lots of times it's medication-based, maybe surgical-based if there's a need, but there's not much outside of that. And so that's what I do at Gates Brain Health. I do rehabilitation for different neurological disorders, dizziness disorders, balance disorders, post-concussion syndrome, where we lots of times will use eye movements, other sensory motor stimulations to rehab the damaged parts of the brain.
Yeah, and then you add the gut to it because a lot of people kind of talk about the gut as almost like a second brain to our body and what it controls. And so you study both of them and how they correlate together. 100%.
Because, as you said, the gut inflames the rest of the body, including the brain. The brain is not separate from the body completely. And so what we're eating, our gut bacteria, our blood sugar, dramatically impact our neurological function.
Which is kind of where it leads us to our topic today, which is, can you measure a healthy brain? I'm assuming the answer is yes.
It is yes, and so much of our current model, and I think the prevailing thinking for a lot of people, is that if they don't have some crazy neurological syndrome, you know what I mean, they don't have a severe neurological syndrome, they're not having a lot of neurological symptoms, that they're okay. But that's not necessarily true. And as we learn more and more going into 2025, we actually find that there are certain blood tests we can do now that will tell us if there's an Alzheimer's disease process 30 years away, possibly.
Okay, so here's a question for you. Is health just the absence of disease?
It's not.
Interesting.
Yeah, exactly. And a lot of us think that.
Yeah.
And if we compare ourselves, let's say in terms of like what would be a sports figure that all of us have some...
Simone Biles.
Simone Biles.
We love her.
So can you do gymnastics the way Simone can?
No. Absolutely
I certainly can't. So there's a difference in function. Though we don't have, let's say, something orthopedically wrong with us, we can't do what she can do. And so if we switch our focus from, okay, yeah, we don't have a disease, but what can we do to make our neurological function better? And how does that pertain to like ADHD, like we were talking about last time, the child who's in class who can't focus? What does that, or how does that pertain to the 44-year-old mom who's working 2 jobs and she has brain function? And maybe that relates to her thyroid. Or it might relate to the 63-year-old grandparent who's, you know, forgetting their words and misplacing their keys. All those examples relate to this element of that our brain health is really, really important, and just because we don't have a problem doesn't
so
mean
our brain ages differently than the rest of our body, or like really like the years that we, you know, blow out on the candles on the cake.
Yeah, and then well, our brain is really important. It's the one organ, or one of the few organs, we can't replace. We can replace the knee. We can even replace a heart in certain circumstances. We can't replace the brain. So you have one brain, and we need to focus on it.
So the question, can we measure this? The answer is yes, but how do we go about actually testing the brain?
And that's where I launched Advanced Imaging Reno, an MRI facility for advanced imaging of brain disorders. We also do whole body MRI screening and anything else pretty much an MRI facility does. But the intent with Advanced Imaging Reno was to bring quantification for brain MRIs to tell us densities of different areas of the brain. Are there damages, or is there damage to the white matter tracts, the small tracts of the brain that you can't see on a standard MRI that relates to head trauma? We're actually looking now at functional MRI, so blood flow parameters for people who have had head injuries and have brain fog and things of that nature. And so we can combine that brain imaging with these blood tests, as I'm mentioning, and really create more of a holistic wellness perspective of how is your brain health at this point in time, and what can we do to improve it, and what can we be focused on in 2, 5, and 10 years from now.
And one of the things that you really like focusing on is what can we do without medication? Like what are the day-to-day practices that anyone can do, whether it's what you eat, how you exercise and stuff, correct?
Absolutely, because diet and exercise are going to be the biggest factors impacting your brain. Supplements to a certain degree as well, but all those lifestyle factors. And I'm working with a lot of individuals now on their brain performance who, you know, are working in fast-paced jobs and high-stress jobs, working with them to help them function better, because if their brain functions better, it's a better computer, so that they can do their job better.
All right, so as we wrap this up, what is like maybe 1 or 2 practices that you think everyone should do every day to really increase the healthiness of their brain?
If we had to say 1 or 2, I would say dietary changes.
Okay.
And
more
exercise.
fruits and vegetables.
Yeah, more fruits and vegetables, that's a good example. Less sugar.
Less sugar. Ooh. Okay, New Year's Eve hitting hard, okay.
Right, exactly. And then more exercise. And we're finding that resistance training is really important for the brain. Cardiovascular training is really important for the brain, along with dietary changes.
Yeah, and not only the brain, but the rest of the body as well. So it's all kind of connected. So I love that we are going to be diving into that connection more as we continue Brain Matters here on Morning Break with Dr. Gates. So thank you so much for being here. We really appreciate it.
Yeah, appreciate you having me.
Thank you. All right, and thank you guys for watching. We'll be right back.